Good morning or good late morning or early afternoon, depending upon where you're beaming in from. My name is Jeremy Adderman. I'm a Senior Director at the National Council for Mental Wellbeing. Thank you all so much for taking the time to attend today's webinar, Co-Creating Solutions, How Community Members, Providers, and Technology Leaders Collaborate. Some quick housekeeping before we dive into things. I think everyone's pretty familiar with Zoom these days, but a reminder, we do have the chat function open. So folks feel free to add in some comments throughout. We welcome some of your thoughts and such. And in fact, if folks want to go ahead and start now and let us know where you're dialing in from, your name, organization, things like that, we'd love to know who's on the line. So chat function is open. If you have any questions for our panelists, we will have some time at the end, about 10 minutes or so for some questions. Try and put those into the Q&A chat. It's a little bit easier for me to monitor rather than putting into the chat function. So chat function, introduce yourself, let us know where you're coming from. Q&A function for any questions you have. Lastly, I'll say, and I'll probably try and say it again, yes, this webinar is being recorded. Yes, it will be available in case you want to pass it on to others or the like. It'll be posted on the National Council's website usually in the next 48, 72 hours. Wonderful. With that, we actually do have a panelist who was having technical issues, so you might see another face join us in just a minute here, but we'll go ahead and get started, and I'm going to have the panelists introduce themselves. So, Jennifer, do you want to start us off?
Sure. Thank you, Jeremy. I'm Jennifer Ria. I'm the Chief Strategy Officer for Boundless. It's a nonprofit provider based in Ohio. Have about 2 decades leading nonprofit health and human services across the U.S. And I've had the distinct pleasure of working with many technology companies along that journey. So excited to talk about that today.
Thanks, Jennifer. Sarah?
Good morning, afternoon, everyone. I'm Sarah Lampy. I am the president and CEO of Prime Health. We are an innovation convener organization that specifically focuses on how we bring innovation in digital health into reach and more is built for the most underserved communities. I have been doing work related to community engagement and partnership engagement my entire career. So excited to bring that into the space around technology.
Great. Thanks, Sarah. And David?
Good morning and afternoon, everybody. Thank you for joining. This is one of my favorite topics to discuss, so I'm glad we get to share a little bit of our insight. I'm the head of well-being at Second which is a global impact consulting firm that focuses on climate and human well-being. I co-founded about a decade ago the Headstream program, which is really at the intersection of youth and mental health and technology, exploring the role that we all can play, as well as technology solutions can play in supporting young people as they're growing up. So excited to share more in some of the learnings and programs that we have built over the last decade.
Thank you, David. And again, we may have one other panelist join and we'll sort of weave her in as we get going here. So, just to say, uh, for the field of mental health, I think it's a really interesting time as it relates to mental health and technology. I think we have never seen such an interest and growth in how technology is being leveraged both within the provision of mental health services, also the impact of technology on mental health and well-being. So it's a pretty sort of buzzy time these days. And in addition, I think the onset of artificial intelligence and sort of how ubiquitous that technology is becoming is only catalyzing a lot of those pieces. So I think more than ever, the conversation we're going to have today and sort of what you hear from the panelists is so important about how community voice, consumer or client voice, how provider voice is being woven into the development of these technologies and how it's being sort of centered in because ultimately these technologies are for those stakeholders. Real quick before we're about to jump into that first question, but Jessica just made it in. Sorry, I know you had technical issues. So we just had folks introduce themselves, the panelists. Jessica, you mind introducing yourself real quick?
Yes, apologies. I'm Dr. Jessica Jackson. I am a licensed psychologist, and I'm also the Vice President of Alliance Development at Mental Health America. I'm very excited to be here to talk about technology and thinking about the lived experience component that is necessary for technology.
Excellent. Thank you. And so let's actually start there. And maybe for this first question, would love to hear from all the panelists. Part of what we're talking about here today is sort of co-creation, co-development. We'll probably use different terms here, but let's start with co-creation as the term. Like, what does that really mean from your perspectives, co-creation in behavioral health technology, and how does that differ in your mind, or how might we think about that differently from either like tokenistic consultation or traditional user testing like technology? Like, what is co-creation really about? So, Sarah, do you want to start us off?
Sure thing. Yeah. I think in when I think of co-creation, I think of how are we ensuring and understanding how we're defining the problem, as opposed to coming in with a defined solution that is technology centered. So what is the problem we're trying to solve? Having those conversations with providers, patients, those who are actually going to be using the product to say, what is it that you need to solve for? And how do we then build and support the technology in order for that to be front and center, as opposed to, when I think of tokenistic or when I think of user testing, the the problem or the solution's already created, and you're utilizing and working with communities or individuals who might use the product to say, is it functioning for you, et cetera, and so on and so forth, as opposed to saying, what are we solving for? And then how do we actually build the technology to solve for that problem, and not here's the solution. Let's back into how it might actually solve whatever problem you might be thinking about. So for me, that's kind of how I think about it in terms of really starting with that problem first.
Yeah, it's where you start and what questions you're asking first. David, how about for Second Muse? I'm sure this is something you all think about a lot.
Yeah, we've had the opportunity to work with over 100 young people, and largely focused on combining that process that we build around youth development with the opportunity to engage with entrepreneurs. I love what you said, Sarah, about thinking about like at what is the time frame and at what point do we bring young people into the conversation, right? Because you're totally right that if somebody's bringing you a fully baked product, like there's very little incentive for the product manager or the marketing team to then go back and kind of take 5 steps back if that's what youth encourage. I think to build like a little bit of framework around it, there's 3 places we think about we think about youth co-creation. We think about the question, what is the intervention? So what is the actual type of tool or solution that we're using to, and this is often driven by market forces and business models and what we can put out there. We think about what is the mechanism? So is it embedded into a social media platform? Is it a telehealth solution? Is it something that's going to be delivered by a school counselor, right? There's different mechanisms that we think about. And then what is the experience? I think too often we're passing on experiences that adults think are fun or cool that often don't resonate with young people, right? And there's so many technologies out there that the challenge isn't to get more innovative technologies. The challenge is to build youth co-created products that young people will engage with, will utilize, and will adhere to over a longer period of time to benefit from the intervention itself.
That's great. Jennifer, you turning over to you said, you've been involved in a lot of the technology conversation more from the provider side, of course. So, what does co-creation perhaps look like or mean, or has it looked like for you on the provider side?
Yeah, I think our voice is a little bit different in the sense of generally what I'm looking at is different solutions that developers have created that they believe are going to solve some problem for providers or are going to sort of be the magic wand that every provider is going to need or want. And some of the challenges that I face or we face is really a lack of understanding about the provider system and how complex it is in the United States. Everything, and I think we'll talk a little bit more about this later, but everything from the funding model to really what's the workflow and the process that most providers engage in. In some cases, developers not being aware that so much of what providers do happens out in the community, and out on the street or out in people's homes. And so one of the challenges is that often these solutions or things that people are coming to me wanting to demo or wanting us to utilize just really don't fit how providers work day to day out in the real world. Or in some cases, it might actually be a great idea and it would be wonderful, but they don't understand the ecosystem and how many other systems we're using. And it's not intended or designed to plug into and seamlessly work with all the other things that we have to do. So I think the conversations really early on and taking the time to understand the ecosystem are vital to truly co-creating something that's going to be useful for providers to take out into the world and make an impact with the people we're serving.
That's a great, segue too. Jessica, I'm curious, your thoughts on sort of how you think about co-creation. But also, you had brought up a really good point when we were chatting earlier about this dynamic of, are we building with communities or for communities? And Jennifer, you're sort of speaking to that as well, where there's a lot of, at least some of your experience has been a lot of like for communities, not with communities, and your community being the provider community there. So Jessica, maybe like I'm curious, like, how do you view co-creation? And then perhaps then like segue into like the sort of the flip side of that is like, what happens when there isn't authentic community input? Like, what happens when we don't have the co-creation that we strive to achieve? Like, what does that look like, or what are like the landmines, if you will, about that?
Yeah, so I second what everyone else has already shared here. And I think that for me, and thinking about just even the perspective of the lived experience community that we represent at MHA, the analogy that I give folks all the time is it's like if you were in a situation where you were unhoused and somebody had built a house and they just gave you the house and they're like, here. And you're like, well, I do need a house. I need somewhere to live. But let's say that the house doesn't have what you need. Maybe you need a ramp to get into the house and it only has stairs and it doesn't have a kitchen and you need to be able to cook. Like that's what's happening is people are building things. I mean, like, but I built this just for you. Use it. Why aren't you using it? Not actually understanding that there are barriers to people not using it. It's not that they don't necessarily want it. They can't use it. It doesn't fit what they need in the moment. And so that to me is a consequence of when you don't have co-creation. You have to actually, I think to what Sarah said earlier, really, how are we co-creating from the point of figuring out what the problem is? Maybe the problem isn't just that I need whatever technology solution, but it's like, how would I access it, right? A lot of people are building things and they're saying, hey, but you need internet. There are a lot of people in the US that people forget don't have consistent internet, for example, that will impact engagement, but they'll say it's for this community. And they're saying, yes, we cannot consistently access it though, so it's not for us. And so I think the consequences of that is that you will see a lot of what is built. A lot of people struggle with what we call engagement. And I say what we call engagement because engagement is very vaguely defined depending on who you ask what engagement is. Whether it's somebody signed up for their tool, whether somebody used it consistently, whether there's outcomes, but it will impact engagement. And so if you have not co-created, you will find that maybe people will try it out and not consistently continue to use it. So you might have something like 10,000 signups, but then when you look at your data, you only have outcomes for less than 1,000 people because people weren't actually consistently using it because it wasn't built for them, which to me is the co-creation piece.
I'm curious, I love that, Jessica. Thank you. David and Sarah, you all do a lot of work with developers and tech developers, innovators, especially in the early days of ideation or considerations. How have you seen, like, how have maybe you spoken to some of those developers or helped coach them or guide them along towards what Jessica's saying and how you start to ask those right questions. Again, I love that house analogy. Like, what have you found works well in sort of supporting some of those developers in those early days towards proper co-creation and avoiding any kind of less than? I don't know, David, do you want to start there?
Yeah, I'm happy to. That infrastructure piece of how to approach youth co-creation is something that we've spent a lot of time thinking about and have developed out an equity-centered framework to do that. And I think a lot of that is based off of our own learnings, which started pretty, nascently in the sense that we started with 3 young people that we were working with, and now that's expanded to 25 young people every year. One of the things that is central to the ability to work with young people in this context is to one, equip it as a two-way street, right? We're not in this just to kind of extract their opinions or their thoughts or their ideas, but this is also a learning opportunity, an opportunity for them to kind of develop skills and professional development. And so we really build a program that centers around that opportunity for exchange. I think that starts to create a culture of trust, a culture of collaboration, a culture that doesn't mean that, doesn't kind of moves us away from that kind of this is a transactional experience. Within that, there's the acknowledgement on our end that as adults or as builders or as developers, like we come with bias, right? That bias is inherently built into us having lived on this planet for a long time and having seen many different things and have experienced lots of different types of bureaucracy, right? That acknowledgement that young people, when I say they, bring all sorts of different powers, right? And so one of the things that we do, which I'd be happy to share with folks that would be interested, is we start talking about different types of wealth. What does cultural wealth look like? What does your community wealth look like? What does your network's wealth look like? There's so many different types of powers and intelligences and what we deem as different types of wealth that people bring to the table that expands beyond what kind of the normal kind of traditional business sense thinks of is like you have 20 years of experience, similarly to how we introduced ourselves, right? We're like, we have 20 to 30 years of experience in X, Y, and Z field. A young person is never going to have that, right? They have incredible lived experience. They have incredible perspective that none of us on this panel are going to be able to bring. And so that piece of empowering them and preparing them before you even get into the, hey, what could this hardware look like? Or, hey, what's this problem or challenge that we could solve and ideate it around?
That's great. And that's a really interesting dynamic you're bringing up between again, whether here you're talking about young people, the consumers, clients, and even the provider voices, the folks who are sort of like the users of the technology, and then the developers, that there's like a playing field that they exist on as well, right? And how we think about how we set that up well for success. And this is making me think, Sarah, you had a really great kind of analogy around driver's ed that spoke to this like dynamic between the folks who are developing and the folks who are sort of like informing or leading that.
Yeah, I mean, I can speak to that. So there's a quote that everyone knows that is attributed to Henry Ford. I did research before this and was like, oh, it's actually nobody actually knows who said it, and Henry Ford may not have actually said it, but it is. If I would have asked people what they want, they would have said a faster horse, which gets at the understanding of like if you talk to people, if you engage people, if you co-create, you're going to get incremental change. And if you really are innovating, you're going to have to think differently about what solution or what problem they're solving for and find something new. The biggest thing that we see is that we get innovators who are trying to think 18 steps ahead of any of our providers or communities, et cetera. And that's great. But then what we are missing is the driver's ed, is that how are we supporting and ensuring that people, they see that you are solving the problem, but they need to be able to move along with you to be able to say, yes, now I can see why this technology is actually helping me, and not because by doing an innovation that's like moving too far ahead, you build a lot of distrust, and you see a lot of, if we're going to go in the car, continue in the car analogy, there are lots of accidents. There are lots of lives lost. There are lots of things and consequential things that can happen by not providing a space through which people can trust what that innovation is going to actually do. I think AI is a great example of this, where we are seeing it leap over a lot of where people are ready to move. How are we supporting and ensuring that all the structures, systems, when you think of the car analogy, like there were policies that were put in place. We had to reform roads. There was a lot that needed to happen to go from a horse to a car in order for us to feel safe, including as late as seatbelts laws that required seatbelts much later in the development of cars. We have to be thinking about that in terms of how we're moving from how it's solving a problem we might have to how we're actually ensuring that trust is built to utilize the innovation effectively.
Yeah, I love that. When you think about David, you were speaking to how much, to use your term of wealth, that in your case, young people, or that any sort of co-creator would bring, any stakeholder group would bring. There's one piece of it, which is, again, like, how are you acknowledging, identifying, and leveraging some of the brilliant, sort of wealth that they would bring, or sort of insights they would bring. But then, Sarah, you're speaking here too, but it's also, it goes beyond just like what ideas do you have and what have you learned and what experiences do you have, but there's this like trust piece, and there's like bringing each other along piece too. That is so instrumental. I don't know, Jennifer, is there anything from the sort of your experience from the provider perspective that resonates here, when it comes to this, like, bringing folks along? I mean, I'm just thinking about like behavioral health leaders and providers are not tech experts, right? No one went to school for those pieces. So how do you think about like your like ability to kind of come along with tech developers there?
I love her. I love Sarah's analogy around the horse to a car, because one of the things that comes to mind for me is electronic health records. And the reality is, great innovation. It does solve some problems. It absolutely improves coordination. It is something that, just like a car did, does bring advances in how we deliver care. Uh, Being a person who's had the distinct honor, I think, of implementing at least 6 EHRs over the years, one of the things that I actually started telling EHR vendors and partners here in more recent years is I believe that there is a responsibility that they have to, in some cases, save providers from themselves, to actually proactively be willing to say, I don't think all these bells and whistles are the right choice for you right now. Here is why. Even if it means upfront, maybe it's not going to be as big of a sale or a deal for that partner or that vendor. The trust that gets created, and quite frankly, the safety that is ensured for that organization implementing this new system, to make sure that they're able to do it in a way that doesn't significantly reduce revenue right off the bat, doesn't cause them to do setup and infrastructure that ultimately doesn't work well for them, or they're trying to design electronic processes that just map or mirror their old paper processes. All of those pitfalls that many providers fall into in implementing EHRs, I would really like to see the EHR vendors and partners themselves take some responsibility to support and help providers avoid those pitfalls and those potential points of accidents on the road. And I think honestly, that is going to result in there being much higher level of trust and a much higher level of willing to see those vendors as true partners for the long run, if that's there from the beginning. So I think there's a long-term payoff and benefit to being willing to take on some of that responsibility and even raise those flags early on.
I appreciate that again, that sort of continued theme of trust, and that, Jennifer, to your point, and now you're talking sort of like sort of usually post product development, when you're sort of in marketing and the sort of sales function, but that there's still such a key piece of trust here. So if you think about the everything from like ideation to technology development to pilot testing, refinement, and then moving, Jennifer, into sort of your piece there too, around like product sales and helping with implementation. I think there's a lot of just sort of steps along the way that I think both the technology developers and vendors, and then the sort of, again, consumers, clients, providers, like there's that sort of dynamic along the way. Do the panelists think, I'm curious if anyone has any thoughts here, like throughout that whole journey, do we feel like there might be alignment or misalignment between like how co-creation might work at those different stages? Like, are there things that are that vendors are disincentivized in doing co-creation at different parts of that, or are there barriers to, again, providers, consumers being meaningfully engaged in some of those steps along the way, that are not to the vendors, it's not a barrier the vendors putting up, but sort of like other sort of like systemic barriers that inhibit consumers and providers being able to be a part of, again, ideation, development, pilot testing, refinement, sort of all the way through.
I Can give a
Everyone came off mute at the same time. I appreciate
I
everyone
know.
using mute for that, but David, go ahead.
I'll give a quick example, and then Jessica and Sarah, I'll let you all jump in quickly. But one example is like, what do young people want? Do young people want telehealth? Do young people want social media content that tells them about mental health? Like, I think there's a big question of what they want. In California, where I live, there was clear evidence that young people wanted peer support. Right. And so a couple of years ago, the state Senate and the state passed a policy that allowed for reimbursement for peer-to-peer support. And that's being rolled out across the state and in many high schools in the state. Right. I think that's an example where policy as well as business models dictate a lot of where their space is to address a problem and really scale a solution to that problem that can be generated from young people. And so when we think about barriers, right, like business models become a huge one, right? Innovation and technology often isn't going to scale if there isn't a pathway to payment. And so that creates then impetus to want to talk to young people, but maybe not having a clear directive for the value of talking and engaging with young people or vendors or consumers in that sense.
Great example. Thank you, David. Jessica?
I was going to say, I think a part of it, and I will say historically, I do think this will change, is the speed of things. And it's not just the speed of building. What happens, and I think this happens for all of us when we're in a project, we think that it takes too much time to explain to someone what needs to be a part of the process. And so when you think about bringing in consumers, when you think about bringing in clinicians or whoever, if they don't have any idea of what even the language that's used for the product team or something, they'd have to explain all of that to then fully feel like they can have a conversation that brings everyone in. And so people feel like they're moving too quickly for that. And I do think that there's a space to be able to say, how do we build a process and let's stick to that process, right? So here's a process that we, built from and we borrowed from another company. Like I've been at companies where we did do that, but it took a whole person. Their role was being able to be a part of in the community with folks and almost be like a translator and to say, here's where we're getting things. Let me translate it to the product team as a part of the co-creation. And I think that disincentivizes folks who are saying, I have to build really quickly, typically because they're trying to get what we call the ROI, return on an investment, from somebody who has given money to the company. Like that whole, I think, process disincentivizes co-creation. I will say I said historically because I do think that the tide is turning a little bit, that for people to continue to get funding, for people to continue to kind of build toward revenue, that they have to have a product that people are going to consistently engage with, which is going to require co-creation. I think it's been slow going, but there are multiple companies that we can see in the space who've pivoted what they were doing because they've gotten feedback and they're like, okay, we need to make this work for the community we're trying to work for. So I think it's a little bit slow going, but I think a part of what was happening at first is everybody was on a race to be first. And especially 2020 to 2023, there was all this conversation about IPO, and then we didn't see a whole lot of people do it. So now people are like, oh, we don't need to race as much. And I think there's space now that people can start to say, okay, how do we bring in a product, perspectives for a product that will allow us to be sustainable in engagement?
Yeah, I love the sort of the economic piece, the finance piece you brought in there. It is also like harking to the role of funders, whether that's, private early stage funders or other funders, like how they can help dictate prioritization of co-creation, of meaningful co-creation. I think a part of it is around timelines and expectations of timelines and ROI. But it's also a resource investment, right? Like you talked about that one company who had that individual sitting and doing that awesome, really cool like translator role, but that's an investment of resources. And I think what I'm hearing you say too, though, is that like if you are so focused on ROI, and that's okay to have at least some focus, I think even a majority focus on ROI, you should be investing in the co-creation because it has a direct impact on the financial ROI. Because you can be first in line, but to have a terrible product that, I mean, Jennifer, you were talking about this, like nobody wants to use it. Don't bring it here. Sarah, anything from you on this front?
Yeah, I mean, I think Jessica kind of took exactly what I was going to say and said it better, which is like it takes time. Like there's aspects of the perception of time around how long it takes, et cetera. Prior to this role, I did a lot of work in community-based participatory research and research-based work. And we all like it's well known that it takes at least 17 years for research, like academic research, to be translated into regular practice. And the work we did by engaging community earlier on, those who are going to be using the research earlier on, we're significantly able to shorten that time frame from 17 years to even closer to 4 years. And so I think what there is a lot of expectation is around we got to move fast now without seeing the longer term outcomes of how investing in those relationships, that trust building, that connection, that engagement early on actually will speed up the uptake of what you are doing and will actually exponentially expand the use of that technology, not just in the community, but in a broader set of communities because you are engaging them early on. It's well known in other sectors. I think technology might be a little bit not slower, but it's I think you've hit the nail on the head. The financial incentive structures have made it such where being able to invest that time early on in that engagement has made it a little bit harder for folks to see not just the value, but to be able to see the value over time and saying, yes, we engage them on day one. So therefore, 5 years in, we have a much higher ROI, even though our ROI the first couple of years may have been a little lower. So I think it's a matter of like, how are we ensuring the investment structures have a little bit longer of a time frame to see that exponential growth when the correct engagement has happened earlier on.
Yeah, I love that. And I think it's also a nice segue. You know, David, you were talking about in California that there was a want from the cohort of it was young people in this case for peer services, but there was no policy mechanism in place for reimbursement, right? From a regulatory and legislative standpoint, there were barriers there. And it does seem like that is a common problem. I think, Jessica, you were right. Like that 20 to 2023 period where everyone was focused on pace so much that folks sort of, I don't know, forgot or didn't think about these like other like, pieces to how these things are sustained, certainly in provider communities and I think in sort of the consumer and lived experience communities. I wonder, I'm a social worker. I am not a technology expert. I say like things like AI and large language models, like barely knowing it, right? But I do, from everything I understand, these technologies around, especially particularly around artificial intelligence, perhaps are going to allow technology developers to move faster on product build and hopefully spend more time on what we're talking about here. Like that would be my hope, is that because it's easier for them to literally code, for example, they could actually spend time. Now, I think that's part of maybe what we're talking about here is the importance of it. But hearing from all of you that it has a huge impact on ROI, meaningful engagement numbers go up. Hopefully, we start to see more of that. But Jennifer, I'm curious from your perspective because I know you had talked about this previously about how it just does it seems that a lot of the developers and technology companies that you engage with, I don't know, like do you even know what I do and what kind of environment and system I exist in? Because it seem to be so like what has been your experience, of course, but also like, do you think that there's something that these innovators and developers can do earlier on to educate themselves so that they aren't building these products that are misaligned?
I think a lot of the problem really stems from how complex our system is. The fact that we have 50 versions of Medicaid across this country, the fact that even then within each of those states, many of us like to come up with our own set of codes and our own set of services and name them something different, even though it's essentially the same thing right across the state line. And then in some places, we even differentiate by county or province or parish. And so the level of complexity that is built into funding what we think of as our sort of behavioral health system broadly, in reality, I think is really hard for developers and is probably somewhat unique even within the healthcare system. And so I do think that they're coming in most cases, not understanding how complex and how different each state and in some places actual communities are. Um, Unfortunately, with how things are built right now, um, research and having the conversations with the entities that you're looking to start with are critical. And the reality that I think a lot of developers have to understand and accept as they're building out their pro formas and looking at sort of their 5-year runs is that if you're going to go from these 2 states to these 7 or these 15, you're going to have to build in the fact that you have to make changes to how your product works to actually make it work for the providers in each of those areas. The other piece, though, and you kind of hinted at this already, that is so critical is the regulatory and policy reform. David had mentioned the peer services as something that may or may not have a funding mechanism in some states. And the same is true for assistive technologies. The same is true for add-ons when you're using technologies. Depending on the state, there's lots of different ways they go about approaching this, and depending on the state, they may not approach it at all, and there may not be any mechanism for using more advanced technologies as part of your services. And so the more that we can have the vendors actually be partners in explaining and advocating with our legislators around why these things should be part of what's paid for, or why the funding models should allow for these things to be part of expenses, it can only help. To your point, we're social workers. We may not have all of the tech lingo down. So having them as partners in making that case is, I think, got to be part of any developer strategy.
Yeah, I appreciate the two sides of that, understanding the realities of environment and doing that up front before going farther down the road, but also acknowledging the like again in David's just one so many examples that there was a need and then they worked with community and advocacy organizations to create the infrastructure, the environment that needed to exist in order for that sort of technology to exist. And I know, Jessica, you and I have talked a lot about that. I mean, it's sort of the role of advocacy and the role of advocacy associations like yours, like the National Council, like, again, Sarah and David are also conveners too. But Jessica, anything that you would add there just in terms of how maybe technology developers can be thinking about that?
I think, the thing that Jeremy and I have talked about a lot is how to also unite some of the voices for advocacy. Because, uh, I think one of the things we haven't directly explicitly said in our time right now is there's a lot. It's very overwhelming. So even as we're talking about everything, it is very generalized, right? There's a lot depending on the age group, the community, what they're building for. I mean, and so I think that makes it difficult, even when we're talking about co-creation, is who exactly do they co-create with, right? I mean, that is kind of almost the crux of it. And I think that is the work of like advocacy partners to a degree, is like, how do we help unite some of that, almost streamline some of it for organizations? Because you look at a company who is building, let's say, totally making this up, but an app of some sort that has a CBT intervention. That seems to be the popular thing right now. And they're like, oh, it's for age 16 to 55. The number of different stakeholders that would need to be a part of that co-creation is very large. So it would make it difficult. And I think that is something that, Jim, we've talked about, like, how do we bring advocacy partners to unite almost together to help streamline that so we actually can get it and help it to be a little bit easier, but to also figure out what is the co-creation piece on? Is it the design? Is it the actual treatment intervention? Is it on, I saw someone had put in the chat, like even sharing data, like there's all these different things that you co-create on, or even what the problem is. And so I think that is some work that advocacy partners could help to do. I think they could step into that gap. Let me say that.
Yeah, I think that I also think on advocacy, maybe a little lowercase a advocacy in a lot of ways as well. And that is around how are we also supporting our clinical partners to actually advocate for themselves, in the sense of like, if they have someone who is saying, oh, I want to co-create with you, and they're not talking to the right people, they're not engaging the right audience, and they're talking about an age group from 16 to 55, to be like, that's not going to work. Like, to push back on that, to be to learn and understand how to advocate for themselves and to recognize the power that they do have in the ability to step in as co-creation. I feel like our conversation's been very heavily like, how do we get technology to be in the co-creation space? But in reality, we also need our provider, our clinical partners to want to engage in that and to be ready to engage in it. I'm not like the biggest fan of always saying like, oh, we need to train people in how to do it. I think a lot of people know in their like understanding of human experience what it means and how it feels to be engaged. I think it's a matter of how do we ensure that they have the understanding of how to push back, how to say, this isn't the right time, or this could be a good fit. Here are the things I want to see. We have a lot of early stage startups, and one of the things that we often will talk to them about is around how are like their bottom line and their, the need to have a return on investment is a huge part of it. So they will often go to the CEOs or the folks in the organization who hold aspects of the purse string. And those are not the folks who are going to be using their products. And so it's also a matter of how are we ensuring leadership knows, yeah, this might be an interesting product, but you actually have to talk to the right people who will be using this and not me. So there's a side on the advocacy piece in my mind around how are we supporting our clinical partners to be co-creators as well.
We had the most unique demo day that I've ever experienced last week, and it speaks to exactly what you're saying, Sarah, in the sense that usually when you think of a demo day, right, you have a whole group of technology and startups, and they're pitching to ideally a big room of investors who are excited to move their resources towards different startups. We've been working with a district in Southwest Florida to support their students and the well-being of their staff and student population. And we brought together 4 different products, startups, companies that were providing services, and they were pitching to a room of 15 different school counselors. And so it totally flipped the script of like thinking about the consumer, the user, the provider as the most important stakeholder in the room, rather than who's going to inject me with a bunch of capital, right? And so I think the more opportunities we have like that to get different perspectives on like what works and what do we value and what's elevated, and move it to different types of stakeholders is powerful.
That's so
Yeah.
interesting. Can I just ask about that too? Because, on the one hand, I'm curious if how the presentations were delivered and what was covered, and whether you felt that it was really different as you might expect it to be, right? Because school counselors care about very different things than investors do. But at the same time, do you feel like maybe if they did change the content or the delivery, are there pieces of those companies, whether it is business model or product design, tech design, that by removing from their presentations, again, you're limiting yourself as the company from getting really valuable feedback from, yes, perhaps not an
Mm.
investor, but by someone who could still have pretty, influential comments or considerations on those sort of traditional like investor related things.
Yeah, it's a really good question because there's one company that is very AI forward externally to a broad public audience, and in this room they were very much mitigating the utilization of AI. And so it was we've reflected afterwards of how curious that was, right? And I think to your point of like, oh, was there a missed opportunity to get feedback here? And yes, in a sense, by diluting the use of AI, like they were assuaging fears that the counselors were going to bring about the utilization of that, but they weren't addressing that head on, right? And so they kind of like put that to the side because ultimately, right, and in many ways, they still want to make a sale here, and so they are speaking to their audience in a way that is coded for that audience.
Yeah, that's interesting
I,
too. Oh, go ahead, please.
So we actually we've run a challenge competition for 14 years now, and that we do ours in the exact same way, where at the end, the 5 to 6 finalists pitch to safety net provider organizations, and they're the ones who vote and determine whether or not the companies win an award to pilot their solution in a safety net setting. And I will say, like, we do pitch coaching, and the pitch coaching is done by a investor company, a group of investors company that does pitching, but we have specifically asked them to focus on how to pitch to providers, et cetera. And any of the companies who don't make it to that pitch coaching session and then come and pitch. Their decks are very different. They're very investor centered. They're very financial centered. Those who did and tweak their deck to be specific to how are we actually building the capacity of our local clinical providers, those are the ones who by far and away will always win because they have tweaked and they have said, this is how we are working with you. And I mean, the decks are different. The way they talk about it is different. They tell more stories. They are more compelling. It's dramatic, the difference between what you would see in an investor pitch versus what we have coached them to do. And I will say their success in a pilot is much greater because those people have said, we are interested. This is solving a problem we have, and we want to work with you. So it's definitely there is a very different feel to that room than in an investor pitch room, for sure.
This is making me think, thank you, Sarah. This is making me think, what kind of framework might this, look like in an ideal state? David, you in some of our chats have talked about how Second Muse thinks about participation in co-creation. So I'm curious your thoughts on like what a co-design framework could really look like, both for providers, consumers, and technology developers. And I know, Jessica, you as well, just to cue you up here too, have talked about some of the challenges around some of the like processes and structures that we try and embed on those like innovation spaces. So I'm curious, maybe if one of you wants to start, just like how could we think about like a proper co-design framework?
Want to go for it, Jessica?
Sure, because I know they have a really good framework. I don't have an established framework, but one of the things that I think the phrase I've used before is we're trying to pour new wine into old skins. And I think not just on the developer's perspective, but as clinicians, we do have to think this is a different way that we work. And so we're all trying to take the ways we've been working and force it into this new process and kind of hope for the best, and it's not working. And so there's accountability on both sides. As people are developing a product, they do need to be thinking about the co-creation piece and what does that look like. But on the other side, as clinicians, as folks, consumers, folks in the lived experience community, we also have to think about how we're giving feedback, right? Which is very different than how we've traditionally done it. So how do we engage in order for the process to run smoothly? Even if all the companies change their framework, if we haven't changed the way that we work as well and how we see our role, then it's not going to the process won't work as well. And so I think that is one of the things that we have to think about is how would we like to be able to give feedback? How would we like to be able to see changes that are also all inclusive? I think the other thing is, having done some of this work with some of the startups I've worked with, everybody has a different opinion because everybody has a different experience with mental health. And all of it, we can't tailor every single thing to one person. So I think that's a part of it. When we talk co-creation, that goes back to a little bit what I was saying earlier, is how do we develop processes that say, here's like very transparently for companies, here's how we did co-creation, so that people can think about how they worked with a specific community or what they did include and maybe what they did not, and that's okay. Because we can't expect them to add everything. And so I think that's a part of the process. If we're used to giving feedback and we're like, we want to see it change right away. Well, maybe we gave feedback in a Google form or something, and they're like, great, you told us what's wrong, but you didn't tell us what you needed or how to change it. And so then that doesn't actually help them fix the product. David, I know you all have a framework.
Yeah, I'll put it into the chat here if folks want to explore. And I think, building on that and what Sarah said earlier, right? Like inherently, almost all of us know how we want to be communicated with and how we want to be engaged with, right? And so I think bringing that into this process as much as possible gets you to a great starting point, right? And then there's obviously little things, and you can dig into this framework that kind of you can add on around acknowledging your bias, around creating the right environment, around building trust, things that we've been talking about throughout this conversation. I think the other thing that like we think a lot about is this a framework called Hart's Ladder of youth participation. And it's built off of a citizen participation framework that existed previously to get citizens around the world to participate in political action. And I think it's really applicable to this space, right? And it starts with all the way at the bottom around manipulation, decoration, tokenism, and then at the top of the ladder is child-initiated shared decisions with adults, right? Child-initiated and directed. And so young people are a part of that decision-making process. They have ownership in that process. And I think sometimes we get caught up in like the extremes of like, oh, this is manipulation and tokenism, or like young people are going to make all of the decisions to decide our policy going forward. How is that possible, right? And like, there's a really broad continuum that we can start to inch and creep our way up, step by step up this ladder to bringing young people in instead of going from where a lot of folks are right now at the bottom to, an expectation that it's unrealistic to have young people who are unequipped to make policy decisions and and oftentimes that's coming from a place of like us wanting to hold on to the power that we currently have as adults.
Yeah, I love that, David. And for folks online, do check out that resource. Others who are watching this recording will sort of have a way for you to link to it as well. Appreciate you sharing that. So it does, it's a great segue to my last question here, which I think is like let's like fast forward a few years and sort of think about like what could like if we saw more success, more alignment with sort of Dave, what you're talking about here, sort of like the upper rungs of co-creation and co-development here. Like how impactful would that be? Like, what do you think that would signal? Like, what do you think that would look like? And how do you think would there be any signals that let us know that we got there? So whether it's 5 years, 10 years, 50 years, hopefully not that long, is there, how might we like envision that future? And what would tell us maybe that we got there? So we'd love to hear from everyone. Feel free to jump in for this last question.
Okay, I'll start. Um, so I think when I think of it, so we have programs that we work on in two sides of the equation. One being that like we have the challenge, the startup challenge I talked about earlier, where our startup companies can pilot with safety net providers, be it behavioral health or physical health. We also have a program called the Colorado Health Innovation Community, where it's really how are we engaging our provider community around innovation, entrepreneurship, really thinking about how to become more like innovative themselves. I think what we found is like our sheep community and our entrepreneur community are solving for different problems, which gets at a lot of the conversations we're having. So our provider community is like saying things like as simple as I need multilingual translation that is available right away. And our innovators are talking about AI models that are solving for a specific health issue, and they're not meeting. There's a huge chasm between what our providers are saying they need and what our innovators are innovating on. I think what we need is some way to bridge that chasm. And I think what I can see if we are moving in a co-creation space is that we have spaces where these two can still exist separately or not separately and not in silos, but ways in which they are connecting, colliding, integrating with each other in such a way that it's not that the solutions are going to be outside of what providers actually need, that we have those convening spaces where it is a true ecosystem of growth and understanding across, no matter what your perspective might be. I think the biggest thing we need to see is our incentive structure to back that kind of innovation, be it from the provider side actually incentivizing engagement in those systems, or our innovator side actually incentivizing that waiting to understand what the providers need. So in my mind, that is where I see us in 5 years if co-creation actually happens, is a more thriving ecosystem between the two, where all of those conversations can happen together. And the incentive structure is such that it's built to that. And the signal that it would truly evolve, I will say, is we have our Office of eHealth Innovation did this huge survey, and one of the biggest things is that they invest in technology and their patients don't ever use it. I think if we could actually have patient and user use, and we don't have those, and we can see that engagement grow, that's when we'll know we are successful.
Thank you, Sarah. Jennifer?
So I think in a lot of ways, echoing what Sarah said, but I kind of wrote this down and keep in mind you did ask for a little bit of magic here. So well, I'm hoping all of this is doable in the next 5 years. So I would say if we've got solutions that actually started with the problem, that would, be a perfect starting point. Um, and you talked about this a little bit, Sarah, but in some way, incentivizing providers to participate in this process. And I'm not necessarily saying financial incentives, but I'm also not opposed to that. But there has to be some incentive for providers to say that among all the other things we have to do, we're saying this is important too. And right now, I'm not sure there's a lot of providers who feel that way. So somehow we've got to figure out what that incentive model is. Um, Solutions that work, they are reliable, they are not overly complex to implement. Um, uh, in some way, we've got to get to the point where over the weekend my phone died, and I was able to walk into the store, tell the gentleman what my problem was, and walk out with a new working iPhone, in less than 30 minutes, and all my apps were on it, everything worked. Like, we've got to get to the point at some day where the solutions that we're asking providers to implement, that we're asking um, people that we serve to use and make, use of, that they work like that. And in a lot of cases, that isn't where we are today. And then finally, that we've got regulatory policy that reimburses for the costs of these technologies. Right now, we don't. And I think if that were a goal that were achieved in the next 5 years, that would be huge.
Thank you, Jennifer. Jessica or David?
Um, the thing I'd like to see in the next 5 years, I think, are two things. One, outcomes. I can't speak for, everyone, but I know that most providers, we get into the work because we want to actually see people get better, recognizing that better looks different for every person. And I think that for consumers who are using any of the technology, they also want to be able to say, I use this and I can see a difference. And that's not just on treatment and intervention. If you're building something that helps me to do administrative work better, that helps someone to get the paperwork that they need, that is helping someone to get better. And so I think that if we can see better outcomes because we figured out which technology works for which groups and who to use it, because right now everyone is marketing to everybody, and you're saying, I built something for everybody. That's not feasible, not in healthcare anyway. Doesn't matter what you've built, every hospital, I mean, Epic is a great example. People talk about Epic, but every healthcare system has a very different version of it, right? There's a reason for that. And so I would love to see in 5 years, we're actually able to track outcomes and say, this is what works for, these specific clinicians, this specific community, this specific size clinic. The other thing I'd love to see is transparency. I saw, someone had a comment in the chat. And I think here's the thing, no one is saying that you need to co-create with everybody for everything, because that is not helpful for anyone. But being able to share some transparency, here's the community we work with to co-create, here's the thing we focused on. If you're going to be around as something that is sustainable for the next 50, 100 years, you have plenty of time to co-create on multiple projects. You don't need to do it all at once, but being able to share, here's what we did co-create on. We co-created on the way that we're talking about social demographics when you sign up for it, and you helped us to think about who this is best for, and that'll impact these outcomes, X, Y, Z. That's helpful. So I would love to see transparency of people saying, here's what we did co-create on with clinicians or consumers, and here's what we'd like to do in the future, would be great.
Thanks, Jessica. David?
You all said it better than I can. I think outcomes, simplicity, integration, we're at this moment of transformation, both because healthcare costs are rising. And so we're going to lean more on digital health, both because AI is expanding and that's going to be integrated into all of our work. And so the more we can lean into during these transformation and influential times and influential moments into those three things, outcomes, simplicity, and integration, I think we'll be in a good place in 5 years.
I couldn't agree more, David, in terms of the acceleration we're going to see here and how I'd love to continue this conversation and dialogue, and I hope others on the line listening in also continue it because we probably should double down in what we're talking about here more than ever because of the things that David was just speaking to there. Um, Drake, good to see your name in the comments in the chat. Sorry we didn't get a chance to get to your question, but a really good one around sort of provider guidance and how they navigate some of the competing priorities. So again, clearly we need to kind of continue this conversation. Hopefully we can find more spaces to do so. But for now, I know we're at time. Jennifer, Sarah, David, Jessica, thank you all so much for sharing your expertise and insights. Really appreciate it. Those on the line, thank you all for attending, and everyone have a great rest of your day.